Sorry, a bit slow here on a Saturday morning. Okay. All right. There you go.
Okay. So, good morning, everyone. Thank you, Raluca, for this very kind introduction. I will be unable to live up all these expectations, but it feels like coming home, being here, and I really enjoy it. So thank you for the invitation. And to all of you on a Saturday morning, thank you for being there. I really hope that I will not bother you too much. I've been told there are quite some people online also by this wonderful man that is always helping there, and also by Raluca. So also thank you for the help. But anyway, also a warm welcome to the people online. This lecture draws on a research project that is currently still running, and you can read the title of the research project. And I'm doing it together with two doctoral students, Kadisha Boyzorn, working on Brussels, and Rachel McCready working on Melbourne, and also with Anthony Pim. So here for today, I will focus on COVID-19 pandemic in Brussels, not in Melbourne, and in particular on the Moroccan heritage population, which I say already here is counting for some 10% of Brussels population. I think and I hope, but that's up to you to tell me later, that the case of COVID-19 in Brussels and for the Moroccan population is to a large extent also symptomatic for worldwide patterns, as I will try to show also with references to other studies. And I hope that therefore this lecture will also permit me to explore how the situatedness of translation entails implications for the role of the translator, for the practice of translation, for the definition of translation, and for the discipline of translation studies. And that's where I hope to conclude. Okay, but let's first start with trying to define translation policy. What is translation policy? There are obviously many possible definitions, and to define it, it's not an easy task because precisely of its situatedness. Just like any other type of policy, it is a complex concept related to the different contexts in which it is used, the different goals it is meant to achieve, the different actors it involves, and you can still complete there. But here, following Gabriel Gonzalez, who was one of my former PhD students, and based on an adaptation of Spolsky, so Gonzalez 2016 and Spolsky 2012, I defined translation policies as the legal efforts, and that's important. So it's really a very narrow definition, in fact, but it's the best definition, I think, for this kind of research. So the legal efforts by the authorities, no one else, to initiate, to impose, or to refrain translation practices. I then define translation practices as the actual activities in the broadest sense, ensuring communication between authorities and people. So it's not about private communication, it's always about official communication. And I define translation beliefs as the various values assigned by members of a language group to translation, again, in the broadest sense. But here I specifically focus, like we did in the project, on trust assigned to official translation. So how do people trust or not translations by the authorities? Now, importantly, according to Spolsky, in order to be effective, because every policy, of course, wants to be effective, according to be effective, policy must be consistent with the corresponding practices and beliefs. And that also implies that when practices or beliefs change, so too should policy, at least to be effective, and vice versa. So you have a very unstable equilibrium if you very unstable relationships, perhaps, or not. The relationships are not unstable. The equilibrium between the three is unstable. But at the same time, and that's also important, there is no guarantee of any direct causal relationship or exact matching, if you prefer that wording, between any of the three elements, precisely because of their situatedness. Okay, so far for policy. Languages in Brussels. I need to bother you with some specific elements about Brussels and about the policies in Brussels, so please bear with me. But as I told you, I hope that they are at least also ringing a bell for some other situations. So the languages in Brussels. As of 2025, Brussels has an estimated population of approximately 1.2 million residents. It's a fact that internationally seen, it's a small city, I think. In Belgian terms, it's a big city, our biggest. Some 40% of Brussels inhabitants are of Belgian origin, 25% of EU origin, you can see it here, and almost 36% from outside the EU. No less than 186 different nationalities live together in Brussels. This makes Brussels, according to other studies, the second most diverse city in the world. In any case, I think we can say Brussels has a highly diverse population. Now, to assess, as I will try to do later, the effects of language and translation policies on the Brussels residents, it is necessary to identify which languages are spoken at home, because that language is the language that you acquire at a young age, and that is strongly related to your identity. It is, moreover, also the language to which people resort in emergency or stressful situations, such as COVID-19. You might be very fluent in your L2 in a stressful situation. It's the same for everyone. You rather resort to your first language, your home language. Now, as you can see here, French continues to be the main home language. Some 33% of Brussels inhabitants, sometimes combined with Dutch or with other languages, as you can see here. Dutch or Dutch plus French is the home language for only some 12% of Brussels residents. So it's not spoken very much. And this is important for everything to follow. So it's important to know that almost 1/3 of Brussels population doesn't speak Dutch or French at home. Now, what do they speak? Here, and that's a political thing, we don't know. Unlike previous editions, because this is the language barometer, it's called the language barometer. These are good studies, methodologically sound, but there are no language censuses in Belgium since almost 1 century, politically too sensitive. Anyway, according to previous editions of the language barometer, which included data on Arabic, because that's the populations I will be focusing on as a home language, there are currently no statistics available regarding the other languages spoken at home. Still, it is safe, I'm sure, to estimate that Arabic continues to be the home language for approximately 10% of Brussels population, because as other studies and previous studies show, knowledge of Arabic in Brussels coincides with being spoken at home. It's not the contact language, it's not an L2, it's the language spoken at home. So let's say, I'm really sure about that. It's the home language of approximately 10% of the Brussels population. Now, many people in this language group, as in other language groups, because they may face challenges related to health literacy or linguistic skills in exactly these stressful or urgent situations, such as during COVID, when communication occurs in one of the official languages, and I will come back to the official languages, of course. So in any case, I think it's fair to conclude that Brussels turns out to be a linguistically super diverse region, where one could expect a big role for translation in order to grant equal access to public services for all inhabitants. Okay, so far a snapshot of languages in Brussels. Let's have a look at the specific language and translation policy in Brussels. So the question here is, which institutions and which policies regulate the provision or the non-provision of translation in Brussels? Now here, and please bear with me, we are in Belgium, everything is complicated, not to say complex. But the form and the function of language and translation policies in Brussels is closely linked to the position of Brussels within the federal constellation. And this is the case for every country, but as you will see, it is quite complex in Belgium. I try to summarize what is most important for what follows. The federal state of Belgium is officially trilingual, Dutch, French, and German. I will speak not about German. In fact, this language group is always okay, never protesting. It will not be, I'm sorry for that, but it will not be about that. I can speak about it later in the questions if you're interested, anyone. So the federal state, trilingual and competent for social securities and important parts of public health. Many other competences, but for us here, important is the social security and public health. Think of COVID. Official communications in these areas obviously must be in Dutch, French, and German, making translation essential to Belgium's governance. Now, as you see here on these maps, the Belgian federal state is composed of 3 regions. I start at the bottom of the slide. 3 regions, Flanders, Wallonia, and Brussels Capital Region. I've been speaking until now about Brussels. I mean Brussels Capital Region, but I will call it Brussels. And Brussels is officially bilingual Dutch-French, implying once again that all official communication from the Brussels authorities need to be available in both Dutch and French. And that once again, translation plays a major role in Brussels governance. But you might make a link with the inhabitants of Brussels and see the match or the mismatch, but I will come to that. The federal state is also composed of 3 officially monolingual communities. That is the Flemish. I'm now at what is it, above the slide. The Flemish, the French, and the German-speaking community. And these 3 communities refer to the persons that make up a community and their language and their culture. And the communities, obviously, they have competences, for example, the use of languages and culture, aspects also of health policy, social welfare, and so on. So these are important for what follows. Now, if we return back to the focus on Brussels, the Flemish community exercises its competences in the Flemish region, obviously, and in Brussels. The French community exercises its competences in the Walloon region and in Brussels. So both Brussels, the federal government, the Flemish and the French communities have competences and have responsibilities regarding language and translation policies in Brussels, in this very small city, in fact. Including during emergencies such as the COVID-19 crisis. Now, obviously, because responsibilities are distributed across multiple competence levels, there is no unified language and translation policy in healthcare and not in other sectors. And this results in fragmentation, unclear guidelines, overlapping practices. In crisis situations like COVID-19, these factors may affect how effectively authorities communicate with the public, and that is what I will try to discuss further. Now, and you have come to that conclusion yourself, I'm sure, despite Brussels' undeniably diverse linguistic fabric, language and translation policies do not address these called communities. Culturally and linguistically diverse communities called communities. Public services are not mandated to provide services in languages other than Dutch and French in Brussels. And thus one can conclude that Brussels language and translation policies are basically concerned with the rights of the Dutch and the French speakers. And you might remember the percentages, not with those of called communities. Obviously, the authorities are faced with growing called communities that require and that deserve access. It's a human right that deserve access to public services, once again, especially in crisis situations. So how did they manage? That's the question that I will try to answer, and please bear with me. In September 2021, in the middle of COVID, there was a special parliamentary committee charged with investigating Belgium's, it's not only about Brussels, but Belgium's management of the COVID-19 pandemic. And it presented its report in 2 languages, Dutch and French, as you can see here. It's a report, it's a long report, 581 pages, but it does not, and I think it will not surprise you, it does not cover language or translation policy, mentioning multilingual communication only 3 times in very vague terms, as you can see there in the quotations. So it asks crisis communication to ensure that the communication is adapted to and accessible, among others, for people who speak other languages. Without further ado. Second quotation, it asks to enable targeted communication for specific target groups, among others, people of foreign origin. And it also, the third quotation, it says that having multiple websites with government information in different languages is excellent. But it adds, and I have not given that quote here, it adds that this information should not contradict itself or each other. These different websites should not contradict each other. In summary, even in times of crisis, authorities, here the Belgian authorities, neglect to implementing multilingual strategies for crisis communication. And as I've said at the start, no surprise, Belgium and Brussels are not unique in this regard. Other studies, and this is just 4 among the many that I found to give you an idea, but other studies show similar findings. Although access to potentially life-saving information in cult communities' native languages is increasingly considered a human right, translation is often missing from the early stage of emergencies, or it is only available in a limited number of languages, which does not match the complexity of the linguistic landscape. Translation is found to be a theoretically essential, but practically ignored part of crisis communication in multilingual contexts. So there is a big need indeed to truly incorporate translation into government's crisis communication strategies, as all these studies and many more found about COVID, but it's not only about COVID. Studies also confirm that crisis managers cannot continue to make abstraction, as they do, of the multilingual and multicultural needs of crisis communication, and should abandon what they call a one-size-fits-all approach. And here, together with the first study that I show here, so together with O'Brien and Federici, I would like to call upon the responsibility of ourselves, researchers in translation studies. O'Brien and Federici rightfully state that the literature that deals with the multilingual nature of crisis situations is limited in fields where it should thrive, such as in crisis communication, but also in translation studies. And they therefore propose, and I really agree, they propose a shift of focus towards considering translation as part of disaster prevention and management. And that is our task, to make that clear. It's not an easy task to make that clear to the stakeholders, to the politicians. And this brings me back to Brussels' bilingual policy model, which experts have described as really outdated, both during COVID and more generally. This is just from a newspaper, but they repeat what some experts say. So they plea for a radical overhaul that would diversify the city's official languages. Now, I cannot go into that, but as I mentioned a few minutes ago, given the political sensitivity of the issue in Belgium, there has been no progress in this respect, even not during COVID crisis. But then the question remains, how did the practices implemented during COVID align with existing policies? And additionally, to what extent were these practices effective in reaching cult communities? So that is what I try to illustrate now. Let's have a look at the official translation policies during COVID. Our research in the project that I mentioned indicates that during the COVID pandemic, authorities exceeded their established policies by providing official communications in languages other than the official ones. There was more translation than allowed by law. Practice preceded policy, but policy didn't change. There was a clear mismatch between policy and practice. And as a result thereof, practices remained ad hoc, without structural embedding, without institutional guidelines, ensuring continuity, efficiency, clarity. Let me give two representative examples. The first one from the Brussels government, and you see it here. So this is the COVID-19 website. It has disappeared, of course, now, but it was the COVID-19 website of Brussels. And as you can see, it used English as a lingua franca next to French and Dutch. Once again, this is illegal. So the Brussels authorities undermine their own language and translation policy, but you see good reasons for doing so. Let me first give the second example. This is from the federal government's website, and it mentioned the following in Dutch and in French, and I will translate it for you. It's my translation. So it basically mentions on this page, you will find posters, information sheets, audio files of the official coronavirus information in Belgian national languages. Most of this information, I find that very illustrative. Most of this information has also been translated into various foreign languages. So most, where do they stop? Which languages? And the available information is organized by language. Now, to be fair, these languages, so this website presented information in more than 20 languages. So that's really a lot. And here is an example of how the information was presented for Arabic. I take, of course, Arabic because my focus here is on the Moroccan community. I will leave this here, and I will make some observations, four observations about what I just tried to show in two examples. No, let me go to the next slide. What you see here is that in order to access the Arabic information, you need to have Dutch or French. Otherwise, you are lost. Anyway, I will come back to that. So I would like to mention four things that, in my view, are striking in these two examples and that are illustrative of larger trends. So first, translation practices vary by competence level and often contradict each other. So the Brussels government is doing something else than the federal government. And this obviously can be especially, or is, I think, especially problematic during crisis, where reaching CALD communities is of key importance, but I think it's always of key importance anyway. Second, authorities were well aware, we noticed also during interviews, authorities were well aware of the fact that translations into non-official languages were illegal, but they turned a blind eye to it just for the time of the pandemic. And I think obviously, rightfully so, necessity knows no law. People were dying. But, and for me, this is even more important, this also indicates that under, let's say, ordinary circumstances, in non-pandemic times, authorities recognize, they know that CALD communities may not have or don't have equal access to public services. Yet, at least in Brussels, protection of the status and position of the official languages prevails upon linguistic rights for the CALD communities. 3, access to COVID-19 information is typically provided through either a lingua franca, English, or the official languages, Dutch or French. I remember the previous slide. Now, once again, considering that approximately 1/3 of Brussels' population speaks a home language other than Dutch, French, or even English, and that, as we've already said, L2 proficiency declines in stressful or emergency situations, like COVID-19, significant segments of the population may face barriers to accessing what I call essential services, especially in that time. And 4, and this is specifically for the Moroccan population, which was the focus of the study, although some 10% of Brussels' population is estimated to have Moroccan heritage, only a selection of materials was translated, and translations addressed the Moroccan community in modern standard Arabic only, with no mention of Moroccan Arabic or Amazigh that the communities, as our data show, were more likely to understand. So far for Brussels, official translation practices in Brussels, but not surprisingly, at least in what I found, sorry, this is it's still about Brussels, sorry. Not surprisingly, cult communities were not reached, and evidence hereof can be found among others, but I think it's a rather easy way to show. Evidence hereof can be found in vaccination statistics. I give two examples, one again. This is a report by the Belgian Health Institute revealed, that report revealed that on October 2021, so really in the middle of COVID, some of the lowest vaccination rates in the country were in the Brussels municipalities, traditionally inhabited by people with a Moroccan background. Here you see the green line. This is the vaccination statistics for the whole of Brussels. So if you would go to specific communities, it would even be lower, and it's the lowest of the whole country. The official, second example, the official COVID vaccination statistics 1 year later, September 2022, showed that only 62% of the Brussels population was vaccinated. And once again, this rate is well below the 78% of the whole of Belgium. And once again, the Brussels situation was not an isolated case. I have found many other studies which have revealed that translated materials on government websites missed their goal because community language speakers were either unaware of these resources or needed first to be literate in the official language in order to access the translations. More in general, these other studies also revealed that translated materials that are not linguistically or culturally appropriate are not likely to be consumed by their target audience, thus defeating the purpose of the exercise. And of course, this is not new for us translation scholars, but you can imagine what is the effect in times of crisis. And also, this is indicative of how far removed crisis responders were from the lived reality of cult communities. And that's very important, and I will come back to that. And it is exactly what we saw in Brussels. So then what was happening in Brussels was that gaps in official communication were addressed by community-led practices. And I will first have a focus on who was doing that and where was it happening. And of course, you cannot separate these from the other points to come. But anyway, that's the way I try to approach it here. So gaps in official communication in Brussels with cult communities were addressed by these community-led practices. In our research, we have observed a whole range of actors with varying, complementary, sometimes also opposing roles. First of all, I would like to mention several organizations. There is Brussels Onthaal, Bruxelles Accueil. It's a bilingual non-profit that provides interpreting and translation for health services. Now, notice that Brussels Onthaal, Bruxelles Accueil, is in itself an institutional anomaly because falling under the jurisdiction of the Francophone and the Flemish communities, normally it should consist of two separate monolingual organizations. So it's an anomaly within the Brussels situation. Now, in 2021, more than 35,000 translation and interpreting services were delivered in 101 languages. And this mainly through the work of volunteers, and I will come back to that, who do not necessarily have a formal education as translator or interpreter. So far for Brussels Onthaal, second organization, also a non-profit, Foyer. Foyer is an organization based in the heart of the Moroccan community, and it produced COVID vaccination information videos, not only in modern standard Arabic, but also in Moroccan Arabic and in Amazigh for the Moroccan community. Did important work for you. Non-profits such as Doctors Without Borders create Mobivax, a pop-up vaccination initiative targeting cult communities. And Mobivax called on volunteers once again, and on its own staff who spoke community languages to interpret vaccination information and other information on the spot for members of the cult communities. Next to organizations, healthcare providers such as family doctors and pharmacists who spoke community languages also played a central role thanks to their linguistic but also physical proximity with community members. Our research showed that they were really instrumental in helping community members to decide, for instance, about vaccination. And gradually, Brussels authorities also turned to community members. So, for instance, the Brussels Health Inspectorate responsible for vaccination announced in July 2021, working closely with priests and imams who could communicate with community members in their home language, very important. And together with local volunteers, the inspectorate, moreover, held vaccination sessions in mosques, for instance, and this in the autumn of 2022. Another initiative was when a Brussels municipality asked pharmacies to display a poster in 13 languages to inform local people about the vaccine and register them for vaccination. Lastly, in the second half of 2021, the Brussels government itself launched what they called the Vaxi buses, in collaboration once again with community members who spoke community languages. And these buses went to strategic locations in the heart of the Moroccan community and vaccinated thousands of citizens from over 100 countries. So let me quickly repeat also that this kind of actions, especially with the help of the authorities, they were all, in the strictest sense of the word, they were all illegal. So all these community level initiatives brought together local authorities, community volunteers, and nonprofits to fill in exactly some of the gaps that were left by the official bilingual policy and its ad hoc translations. Once again, other studies about places with different language and translation policies share similar findings and give, I think, and I find this important, they give a nuanced picture of the situatedness of translation. So you might have a very different language and translation policy and still find that the same practices as we saw in Brussels were effective in COVID. So a nuanced picture of the situatedness of translation. These studies also point to the increasingly important role played by volunteer translators during crisis, the need for tailored messages at grassroots level, the need to engage with religious or cultural community leaders or representatives, because they are considered a reliable source of information, with key information also shown in other places, being shared often verbally at religious gatherings. Now, for us translation study scholars and translators, this does not mean we thought in our project that professional translators should be replaced with volunteers, but that both should work together, as they do already often, and there are many interesting studies about that. They should work together and not only focus on these professional translators. Okay, now, still community-led practices, how were these practices being done? We have already, of course, it's not feasible to separate, but I will focus now on the how in terms of multimodality. So what we saw in our study, and again, this will not surprise you, an important characteristic of successful community-led translation practices is their multimodality. In the Brussels community, members reposted translated messages on the social media, which was preferred by each community. And what we saw happening was especially WhatsApp for low educated people with few networks, few access points to information. And these were these verbal messages, so no text messages. Or these community members turned to intersemiotic translation or the adaptation by converting print or web texts, sometimes already translated text, to re-narrated spoken audiovisual communication. Similarly, with the help of community members, Foyer, this organization, adapted public health information to multilingual videos to WhatsApp voice recordings, and to presence at mobile vaccination points. And as I've said already, Foyer did so not only in modern standard Arabic, but also in Moroccan and other variants of Arabic. And this was a much needed way to complementing official policies and increasing community access. Indeed, more in general, our research, and I find this very interesting, showed that written text formats alone are never sufficient. Multimodality is crucial, often because of low literacy and also combined sometimes with low digital literacy of many of these CALD community members. So multimodal, non-written, multilingual communication delivered with the help of community members, volunteers, and nonprofit organizations realized what the official policy obviously was not able to do, granting access and hopefully equitable access to COVID-19 information for CALD communities. And not surprisingly, similar things were happening in other places in the world, like New Zealand or Australia, but there are many other examples, where studies found that multiple platform approaches, including traditional media, local community radio, SMS, MMS, digital platforms, social media such as YouTube, WhatsApp, WeChat, sometimes with the help of influencers, proved especially efficient. Research indicates, moreover, that this kind of inclusive communication should not be limited to times of health crisis, such as COVID, but should rather be an essential component of sustainable, inclusive, and democratic societies. A fair language and translation policy should therefore strive for equal access for all, also beyond a period of crisis, because what we found was that once COVID was over, everything returned to normal. But is it normal? I would not say normal, but you know, you know what I mean. Yes, okay. Last part, the beliefs. You remember the definition, policy, practices, and beliefs. So what we also did research on in our project was, did people's beliefs align or not with the policy? More in particular, did people in the Arabic and Amazigh speaking Moroccan populations of Brussels, we did only research on this population, did they trust the COVID-19 messages? Now, we know that when the messaging is mediated across languages, the act of trusting, which is so important in these times of crisis, the act of trusting becomes not only harder to achieve, it is technically doubled. One can trust or not the source of the message, here the government, and one can trust or not the mediator who delivers the message. Now, what was the general picture? In 2021, you had this Edelman Trust Barometer, which indicated that trust in all information sources had reached record lows globally. This is about the whole world during the pandemic in 2020, sorry. So these are times that are especially difficult for trust. We had also this vaccine confidence project, which also was carried out globally, found that in 2022, the percentage of respondents here for Belgium agreeing that vaccines are safe was 75%, which is quite high. And the statement, second figure, the statement vaccines are compatible with my beliefs was also agreed to by 74%. It's not the highest in Europe, but I think it's still quite high. The same study found that it was only 54% in the United States, for instance, only to give that example. Now, more specifically for Belgium, a study found that people who trusted the government in its dealings with COVID-19 or who trusted experts who advised the government were more open to vaccination. So trust obviously played a big role. And another study, conversely, found that lower trust in authorities in general was one of the predictors of COVID-19 vaccine hesitancy in Belgium. But what none of these studies did was to consider the language mediators themselves as possible variables, and that is what we tried to do in our project. So we asked whether the increasing integration of community-based mediation practices changed the nature of trust, potentially growing from What you know is thin trust invested in trained translators whose authority is narrowly defined, narrowly confined to a professional code of ethics. If this kind of trust was changed into thick trust accorded to a known community-based mediator whose credibility is grounded in broader social and ethical relationships. And obviously, this is important for the general relation between trust and translation, as a preference for a thick trust may question the normative reliance on professional translators, even in the context of this kind of communication. So it's important for the discipline, I think, to have a view on that. Now, what we saw in our project is that in Brussels, community health workers saw themselves as actively creating trust. This is a quotation from an interview translated into English. People like me can be bridges, says this community translator. It is very important that people like me can be open, that we can understand what the situation is in the minds of other people and try to reduce barriers as well as maintaining that proximity or distance, but still building the trust relationship. So understand what is in the minds of the people. Okay. We also found, and these are only two examples, of course, of many, we also found that trust was less related to what was said or which language was used than on who was providing the information. So, for example, a Mahmoud from Marrakesh, and he lives in Schaarbeek, which is one of the Brussels communities, communities. And he asked my colleague Manu, she's from La Louvière, for example, she's blonde and beautiful. He asked her, is the vaccination halal? If she said yes to him, he will definitely not be sure that if this is true. Sorry for the oral language, but if he comes to me, so this Mahmoud from Marrakesh, if he comes to me as Muhammad, even if I don't pray, even if I don't even follow any religious practices, even because my name is Muhammad and my skin is a little bit like the Moroccan skin color, he will believe me if I told him that it is halal and that's it. Okay, just an example about who is providing the information is important. Now, in Belgium, there is no explicit requirement for translators or interpreters to be certified to work for government bodies. You see the situation in Belgium. Nor is there any official distinction between translators, interpreters, and bilingual workers. Think of Brussel Onthaal volunteers. There are, however, as we have everywhere, codes of ethics calling for neutrality and non-advocacy. In theory, these codes should ensure that the public trusts the translators independently of who a particular translator is. Because on the code, all translators become the translator. Now, in Brussels, while certified interpreters were involved, much of the mediation work, as we have seen, was carried out by mediators, which were embedded in the community. And it might be tempting to align thin trust with professional translators and interpreters and thick trusts with community mediators. And then to surmise that COVID-19 years saw a shift from one extreme to the other. But, and I think it's interesting, our interview data complicate that reduction in several ways. For most of the community mediators, thick trust does not involve advocacy in the sense of pushing agendas. And think of the first quotation. It's more a question of seeing things from the perspective of the community member. And that's very important. Ensuring that information is available in a way that is accessible and making sure that the community voices are also heard in the community process. Very important, but it's not about pushing the agendas. We saw community-based mediators not only fostering thick trust, but also raising questions about their ability to maintain neutrality. So they also have this in mind. We found cases in which personal opinions were suppressed. I'm not vaccinated, I'm a community man, but I don't believe in vaccines. So personal opinions were suppressed while translating and why pushing? Well, pushing why asking people or giving arguments to people to translate, because they applied, these volunteers, they applied a kind of what you could call a professional ethics based on thin trust. And in this way, the aims of both thick trust and thin trust communication can meet, we thought. We still think, at least to the extent that both seek to give equal access to information, but in different ways and with different notions of equality. Thin trust messaging is the same for all, should be the same for all. Thick trust communication adds adaptation and dialogue to ensure actual access. But both seek the same goal, even in different ways. And when we, and this was our conclusion for this part, when we pursue this line of thinking, we find that several trade-off positions appear along the axis that goes from thick to thin trust. One of these points would be where, as we have found, accurate official translations are needed for technical terms, and community adaptation is needed for everything else, and both should then be combined. Another point would be where an official translation is received by the community mediator and then adapted to specific groups and needs, as we have seen in practice, but it's not part of the policy. And this has also been found in other studies, and it should happen more, I think. Yet another is where community consultations happen prior to the production of official translations. Why not? As also recommended by some other studies, and I can give you the references. In the end, we found that both thick and thin trust have their roles to play. The more one seeks thin trust, the less one can be sure that information is understood and can be acted upon. The more one seeks thick trust, the less one is sure that all citizens are receiving exactly the same information. And in between the two extremes, we have been able to locate these number of trade-off points where the two kinds of trust are mixed, and we think that both aims should be sought at the same time. Okay, how am I doing time-wise? 5 more minutes. That would be my conclusion. I hope you still bear with me. So in this lecture, I've tried to approach translation as a situated and materialized practice, operating within specific political and institutional settings through the lens, and it's a very specific lens, of translation policies in Brussels during COVID. As a conclusion, I would like to zoom out a bit and formulate some more general recommendations concerning four elements, and you have them here, and you have also my conclusion shortly. So, for the role of the translator, the observed successful collaboration between professional translators and non-professional translators, volunteers, community members, and organizations makes us aware of the fact that the translator does no longer work between languages. Should this be repeated after this conference and after everything that has happened in the discipline? No. A translator does not work only between two languages, but between many contemporary parts of social life. I stay quite general there, but it is a very broad picture, and I like this expression, many contemporary parts of social life. So the consequence should be, I think, that we not only need an expanded definition of the translator, we do, and it is happening, in order to overcome the binary professional, non-professional, but we also need to adapt, and it is also happening, we need to adapt our education programs, and we need to adapt our codes of ethics. So far for the role of the translator. The practice of translation. In our project, and also in other studies, we have seen many examples of the situatedness of translation, operating within specific political, institutional, demographic, and other settings. Hence, the need to factor in these settings proactively, together with the stakeholders. Important, and once again, it is happening. And it is not really new, but crisis situations make us aware of the fact that there is still a way to go also in non-crisis situations. And that's, I think that's a more important message that I would like to give than the one about the crisis. Conversely, the observation that effective practices during COVID were consistent across many settings should encourage policymakers to adapt their policies accordingly. It works everywhere, so to say. This is a gross generalization, but let me still conclude saying that it works everywhere. And this also gives to us as researchers a nuanced picture of the situatedness of translation. So we should also there move into the extremes, not go for the extremes. And furthermore, since communication today implies a combination of different media, it is essential that that translation transitions from mainly text-based practice, should it be repeated, to a multimodal practice. And this is also already happening. We need new translation practices, and multimodal translation is becoming a necessity. Many studies and also this conference testify of that. This brings me to the definition of translation. Developments in multimodal translation, as we know, multimodal translation studies have already changed our idea of what translation is. And together with many people, I think that we need an expanded definition of translation, precisely because of this combination of semiotic modes in our digital ages, meaning making. Translation has become and should be studied and is studied as a complex, collaborative, and unpredictable process, which involves much more than written text, we know, much more than the binaries that have traditionally delimited its field of study. Now, such an expanded definition, and this for me is important, does not mean that everything is a translation, because then it would become nothing. It does not mean that everything is a translation, but that many things, and I'm referring here to very wise words of Michael Cronin, that many things have a translational dimension and can be better understood if this dimension is taken into account. And then lastly, the discipline of translation studies, obviously more interdisciplinarity is needed. No single disciplinary framework can be an adequate approach to our multimodal world. Also, whereas descriptivism, I have been raised, so to say academically raised in descriptivism, whereas descriptivism has for a long time dominated translation studies, and nothing wrong with that, we still need it. I think that research in translation policies makes us aware of the need to develop the applied branch of the discipline. If we really want to help authorities and policymakers in developing fair language and translation policies, we cannot remain neutral. We do not have a choice between freedom and regulation, just to use these words, or between neutrality and engagement. Rather, we must choose between different forms of regulation and engagement, between different translation policies. So we need normativity and we need the applied branch. Let me stop here. Thank you for your attention.